Most people would agree that healthcare in the United States is to some degree screwed up. Here's what's interesting to me about medical insurance. Have you noticed that it's not like any other kind of insurance? I have auto insurance in case I get into an accident. I don't pay a premium every month and send in claims for all of my fill-ups, all of my oil changes, my car washes. I just pay those things out of pocket. I have life insurance in case I die. With healthcare, for some reason, insurance was designed to protect you in case of an unforeseen circumstance that costs you a lot of money, something that's hard to plan for. In other words, for a catastrophe. But what we have in the United States is more like prepaid medical. I'm not sure how it became a right for every American to have a prepaid medical plan. A big reason that we're having so many problems is just that. Can you imagine the administrative headache that we would have on our hands if we did have prepaid auto? Say you had this giant bureaucracy managing your auto care. So every time you get a fill up, you have to submit a claim and somebody has to process that claim. They have to decide, let's see, your gas, they charge this amount, we're going to reimburse this amount, and we're going to negotiate. We think that and incidentally, you have to choose our provider. You can't just go to any gas station. You have to go to one of our pre-approved providers of gasoline. You'd have somebody to process this form. You have all of the forms. You have all the laws that would regulate these forms and this prepaid auto plan. All of a sudden, just filling out my car would become a lot more complicated than it ever was before, when I used to just go to the station, swipe my card, and be on my way. The nightmare scenario that I just described that would happen if we were to have prepaid auto maintenance is exactly what we have in the United States with our health care. So we have so many conditions that must be covered by law, or mandated to be covered by law, that our whole system is bloated, complicated, and has extremely high overhead costs. So in 2012, when Sandra Fluke was complaining that her birth control wasn't covered, my problem with that is not birth control and covering it. My problem with it is that it costs $9 a month at Target, and it doesn't make sense to have that filtered through a bureaucracy. To give you an idea of how bloated a bureaucracy it is, if you look at, say, Medicare, so also an administrator of medical payments, but Medicare is for seniors. The administrative overhead for Medicare is 2% of the federal spending on it. The administrative overhead on the Affordable Care Act is 22.5% of its spending, or $250 billion. That's a lot of paper clips. What we have right now is very expensive to taxpayers. It's very expensive to the federal government. It's also highly expensive to the insurers. Last month, United Healthcare announced that they are no longer going to be providing private insurance. They are the largest private insurer in the nation. They said that in 2016 alone, they are going to lose $200 million because of the Affordable Care Act, and they simply can't afford it. Here in Minnesota, we have a state exchange called MNsure. Preferred One covered 60% of those enrolled in MNsure, and last year they pulled out because they were also losing money on it. So if you look at where things are headed, what we have is an unsustainable system. One of the biggest problems that I see with that is the long list of conditions that must be covered under our prepaid medical that really amount to oil changes and gas fill-ups. And those sorts of things people should be covering out of their own pocket. So I would suggest that we get back to insurance. If you have a story yourself that you would like to share, I would love to hear those. I've been hearing a lot of people's stories with the Affordable Care Act. Leave your comments below. If you like this content, please like and subscribe. Thanks for watching.